So our keynote speaker today is Nancy Polyhronopoulos. Nancy earned her bachelor's degree from the University of British Columbia and has over 20 years experience in nursing. Nancy's nursing career began as a staff nurse in neurosciences and then as a clinical nurse educator for the Department of Neurosciences. She completed her neurosciences certification and was involved with the provincial and national neuroscience nursing organization as a member of the scientific committee. Nancy currently works as a clinical resource nurse in the Deep Brain Stimulation Clinic at Vancouver General Hospital in Vancouver. Please join me in welcoming Nancy.
Good afternoon. Thank you everyone for allowing me to spend part of the afternoon with you. I'm really happy to be here. Today I'm going to be talking about autonomic and cognitive changes in Parkinson's disease. As Carolyn said, I am a nurse in the Deep Brain Stimulation Clinic. And when patients come into the Deep Brain Stimulation Clinic, we're usually seeing them for movement issues because that's what deep brain stimulation helps with, is motor fluctuations and tremor. But through our assessments, when we see people on a daily basis, we often find when we ask them, what is your biggest issue right now? It's not their movement. It's some of the non-motor symptoms of Parkinson's disease. Pain, changes in thinking, bladder function, all these sorts of issues tend to be big issues for people and bigger than the motor issues for some people. So today I'm going to highlight some of the non-motor features of Parkinson's disease, specifically the autonomic changes in Parkinson's disease, and how we can treat some of those changes that you might see. And then I'm going to switch gears a little bit and talk about cognitive changes in Parkinson's disease and some of the things that are out there for treating. Okay. Although Parkinson's is generally thought of as a disease that primarily involves movement, you all know that in addition to the motor symptoms like slowness, stiffness, tremor, people develop what we call non-motor symptoms. Okay? And these are a diverse group of symptoms that can have a significant impact on quality of life. So this afternoon, I'm going to focus on autonomic changes. I'm just going to see if I can move this. Have I got the mouse up there?
It's there.
Oh, it's there? Okay. Why can't I see it? Well, I'm visual spatially challenged here. Well, anyways, I'm going to talk about autonomic changes. So things like constipation, urinary incontinence, erectile dysfunction, sweating, postural hypertension or hypotension, and excess salivation, as well as what you might call neuropsychiatric, but I'm talking about cognitive impairment more so than dementia today. All right, so what do we mean by autonomic symptoms? To understand what this means, I'm going to give you like a 1-minute review of the nervous system. I'm not going to spend time going through it, but just to know that the nervous system consists of 2 divisions. You have the central nervous system, which is your brain and the spinal cord, and the peripheral nervous system, which consists of all the nerves that leave the spinal cord and the brain that go and innervate our muscles, organs, and glands of our body. Okay? So the autonomic nervous system is part of the peripheral nervous system. So it's the nerves that go into the organs, glands, muscles. Okay? The autonomic nervous system controls the automatic functions that occur in our bodies. So things like heart rate, breathing, swallowing, blinking, ability to empty your bladder. The autonomic nervous system innervates the organs, muscles, and glands that we don't consciously have control of. Okay, so we do have a little bit of control of some things. Like we can make ourselves blink, we can make ourselves swallow, but if we tried to hold our eyes open for a long period of time, eventually our eyes would blink. It would reflexively blink. Okay. So when the autonomic nervous system fails to work properly, we call it autonomic dysfunction. And in Parkinson's disease, this usually happens due to the loss of dopamine-producing cells in the nervous system. The dopamine is what helps smooth the transmission of messages along the nerve cells. and allows for nice, even fluid movement. And that can happen in the muscles and organs as well as buildup of microscopic protein deposits called Lewy bodies in the terminal end where the nerves go into the muscles and organs. And when you get a buildup of these Lewy bodies in those muscles and organs or glands, it causes degeneration of the cells in the area, and things don't work quite as well as they should. Okay. As well, to complicate matters, many of the medications that are used to treat the symptoms of Parkinson's disease can affect the autonomic nervous system and make the symptoms worse. Approximately 90% of people with Parkinson's experience some form of autonomic dysfunction. And in fact, a lot of the newer research out there is showing that perhaps the peripheral nervous system is being affected long before we start to see motor symptoms in people with Parkinson's. So people may have complained of constipation for years prior to the onset of motor symptoms. So there's more and more research going into looking at the peripheral nervous system to see if we can identify changes ahead of time that might predict developing Parkinson's down the road. So I'm just going to talk a little bit about some of the different things you might see and some of the things that you can do to help with what you might be experiencing. So the first one is drooling. In Parkinson's disease, drooling is caused by two things. One is you have a decreased reflex swallow, and there's a little bit of debate in the literature, possibly increased production of saliva and also increased speed of which it's being secreted into the mouth. So you've got a swallow that doesn't work as well and more saliva being produced. Most of us, if that saliva came into our mouth, we'd just reflex swallow it without thinking about it. But of course, in Parkinson's disease, when that swallow is slowed or impaired, the saliva tends to pool in the mouth rather than being swallowed. As well, with Parkinson's disease, sometimes there's a forward flexed posture of the head or the body, and then the saliva tends to pool in the front of the mouth. And as Parkinson's progresses, many people have trouble keeping their lips tightly closed, and sometimes, further on in the disease, there's an open mouth posture as well that makes it difficult to control the extra saliva in the mouth. And this can lead to things like coughing or choking on saliva, sores or cracks at the end of the edge of the mouth, as well as tooth decay. A lot of the components of saliva, if your teeth sit in it for a long period of time, it can actually decay the teeth. And there can be more serious complications as well, such as aspiration pneumonia. And besides all that, it can actually be quite embarrassing for people that are drooling in social situations. And this is just a picture of some of that. You can see how uncomfortable that would be if you were drooling and you were constantly wiping your face and getting sores. It can be quite painful. So what can you do to help with these symptoms? Chewing gum or hard candy, but I do recommend sugar-free because you don't need the added sugar to decay the teeth. Sipping on a drink frequently to help wash down the saliva, because if you're sipping on a drink, it's reminding you to swallow. And this actually has another benefit as well. It helps to increase your fluid intake, which is important in Parkinson's, because a lot of people don't tend to drink a lot either because they may be tremoring and it's difficult for them to actually lift the glass up to their mouth, or they are worried about having to go to the bathroom frequently, so they may cut back on their fluid intake. So if you're sipping on a drink frequently through the day, then it's going to get that water intake up. Many people carry a Kleenex in their hand, but one thing I was talking to someone that they did is they wore a sweatband on their wrist because they kept losing their Kleenex, and then it was a discreet way to just kind of wipe or blot the corners of their mouth without people noticing. Okay. It sounds silly, but making a conscious effort to swallow as well, just reminding yourself to swallow. And apparently, I haven't looked too much into it, but there are some swallowing prompt apps that you can put on your phone that remind you to swallow. You may want to consult with a speech-language pathologist as well for exercises to strengthen your swallow and strengthen the muscles of the mouth. Just reminding yourself to keep the head posture upright when you can. And one other thing I thought was interesting is humming. If you're humming quietly to yourself, you're having to keep your lips closed, so it prevents the leakage of saliva from the mouth. Okay? There are medications as well that are out there. I'm not going to go into all the different medications because I think it's important to have a discussion with your healthcare provider about what is the appropriate medication for you to use. Just be aware that some of the medications that they use to dry up the saliva in the mouth can actually cause you to have a very dry mouth, and then you've got the opposite problem. Okay? And there is Botox. If it's a really bad problem, they can do Botox into the saliva glands to help decrease some of the production. But these are all things that you would need to talk to your physician about. If somebody does have a significant issue with increased saliva, and you notice that they're coughing and choking frequently, it would be warranted to have a swallowing assessment by a speech-language pathologist, just because there is a correlation between drooling and difficulty swallowing, what we call dysphagia. So it would be worth getting a really good workup to make sure that there's not something more going on there. While most of the world is battling high blood pressure, one of the potential complications of Parkinson's disease and the medications that we use to treat it is low blood pressure. We call it orthostatic hypotension. If a person is unable to maintain an adequate blood pressure, the blood flow to the brain is decreased, resulting in that sort of lightheaded feeling and dizziness. Have you ever gotten up too quickly and moved, and all of a sudden you feel just kind of dizzy and you can see little stars flashing and maybe feel a little bit of a headache and nausea? That's exactly what orthostatic hypotension may feel like. And sometimes it doesn't have to be that obvious, like when someone stands up and they feel dizzy and lightheaded. It could be a little bit non-specific, such as fatigue. So if you're not getting enough blood to the brain, not enough oxygen to the brain, you may feel fatigued. It may just be little bits of headache or confusion, which sometimes can make it hard to know exactly what you're dealing with. As well, it's a big contributor to instability and falls, okay? And it affects about 30% of people with Parkinson's, and seems to increase with age and the longer that you've had Parkinson's disease. So if you don't have it early on, you may develop it later on. Okay, so what can you do about it? Well, we know it significantly affects your ability to do activities of daily living, exercise, hobbies, social events. If you're not feeling good, if you're worried about being dizzy, you're not gonna get up and go. So it's important to really look at why this is happening. A lot of people are on blood pressure medications. You may have had high blood pressure, but once you've developed Parkinson's disease, you may no longer need to be on your high blood pressure medication. So it's a good idea to go see your doctor and make sure that they do a good workup, look at your medications that you're on. Look at the fluid intake that you're ingesting during the day, because if you're dehydrated as well, you have less blood volume circulating, so more chances of becoming hypotensive or low blood pressure. Side effects of other medications such as diuretics, depression medications, and some of the dopamine agonists that we prescribe for Parkinson's disease can also cause blood pressure to be low. And there's other medical conditions like diabetes, heart conditions, lots of different things that can contribute to this. Okay? But some of the things that you can do just to, if you're experiencing the symptoms, would be to increase your water intake. And they suggest about 5 full glasses of water a day. So what I like to think is like a 2-liter pop bottle. If you fill that up and get through that during the day, that would be great. But as well, if it's a problem when you get up in the morning, before you actually get out of bed, try drinking a full glass of water. That'll help. Change your position slowly and carefully. I think most of us, getting up off the couch or out of the bed is an automatic action that we just do, but you need to stop and break it down a bit. So when you're waking up in the morning, get up and sit on the side of the bed, allow your body to readjust, and then stand up. So don't do everything at once. Break it down into steps. You could try elevating your legs while you're sitting in a chair. And some people will even elevate the head of their bed with pillows, so that, or put blocks under the legs at the head of the bed, so it keeps the body more upright. You want to avoid hot environments like hot tubs and saunas, because they're going to cause what we call vasodilation. So the blood's going to leave your head and sort of start pooling in your extremities, and you're going to get lightheaded. Avoid large meals. When you eat large meals, the blood tends to pool around your stomach and your internal organs. So again, you can get lightheaded after large meals. So smaller, if you find that after you eat large meals that you're getting very dizzy, you might want to consider having smaller, more frequent meals during the day versus 3 big meals per day. Unfortunately, alcohol does cause vasodilation, so if you have to be careful if you're having a drink here and there, that when you're getting up after having a drink, that you're not getting lightheaded. If there's no restrictions in your diet, then you can add extra salt. And I would talk to your physician about this to see whether this is a safe option for you based on other health conditions you might have. There's also a compression hose or elastic stockings, but the problem with them is that they can be very difficult to get on. So in a practical world, that sounds really good, but when you actually have to physically try to put them on, it can be quite difficult. And again, there are medications that they can give you that can help if it's a continuing problem with low blood pressure. And sometimes there are medications they can give around meals if it seems to be meal times or the times when you're getting lightheaded. Okay. All right, bladder dysfunction. Our bladders hold about 500 mils of urine, and most people empty their bladders about 5 or 6 times a day. And the bladder is like a balloon. As it fills, it stretches. And when it gets about half full, the bladder sends a message to the brain saying, it's time to empty. In Parkinson's disease, that feedback message that goes from the bladder to the brain and then the brain back to the bladder telling it to empty is interrupted. And then the message telling the bladder to empty is disrupted. As well, the muscles in the sphincter of the bladder may also be weakened by the Parkinson's process. So you've got 2 things going on. You've got a mixed message from the brain to the bladder, and also the muscles are weak. So there's 2 types of bladder dysfunction that you may be aware of, and one is overactive bladder, and that's when you have that urgency, I have to go to the bathroom now, and frequency, going quite often, and also getting up in the night to go to the bathroom as well. So you can have an overactive bladder, and then you can also have an underactive bladder. So you have difficulty initiating urination. You can have that sensation of your bladder not fully emptying, and then you can also have leakage or dribbling of urine. Okay? And the trouble with this is that incomplete emptying of urine from the bladder could lead to infection. Urinary tract infections, which can worsen the symptoms of Parkinson's disease. And about 75% of people with Parkinson's will develop some sort of bladder issue over time. So what to do? You want to investigate the cause. You want to make sure that there's nothing else going on, no urinary tract infections. People with diabetes can have frequent urination, so need to make sure that there's nothing else going on. Men that have prostate issues, women may have weak muscles, weak bladder muscles from childbirth. You may need a referral to a urologist to really look at the problem and understand what's going on. Caffeine and alcohol are diuretics, so you want to be careful with the amounts that you're drinking of these types of fluids. Things you can do are decreasing fluids after dinner. especially if it's a problem at getting up in the night to go to the bathroom. Bathroom schedules, I mean, it sounds funny, but if you are in the habit of going to the bathroom every 2 hours, it's going to help with some of that urgency and frequency that you're seeing. Easy access to the bathroom, making sure that there's not a lot of blockages in the way to get to the bathroom, especially if urgency is an issue. You could consider overnight having a urinal at the bedside or a commode so that you're not having to try to negotiate to the bathroom, because a lot of people at nighttime too, their motor symptoms are a little worse because they may not be taking medication through the night, so it's harder to get to the bathroom as well. There are pelvic floor exercises that do help both men and women to strengthen those muscles of the sphincter. As well, just simple things like loose, easy clothing if urgency is an issue. And aids or incontinence products. It's important, especially if you're having some leakage of urine or dribbling of urine, if that happens, you can end up with skin rashes, skin breakdown from the urine sitting on the skin. So some of these incontinence products wick the moisture away and keep the skin dry and prevent infection. So they are very helpful. And there are medications that you can talk to your doctor about that might help with either overactive bladder or underactive bladder. And again, they can advise you on what might be the best option for you. I will say, you know, we talk about decreasing fluid after dinner, but again, I want to make sure that you don't try to restrict too much fluid in your diet because you're worried about frequency and urgency. If this is a problem, it's good to talk to your doctor to see if there is something that can be done to help rather than restricting too much fluid and running into problems with dehydration. All right. Yeah, constipation, a common problem for people with Parkinson's. It can actually predate the onset of Parkinson's by years. The autonomic nervous system controls what we call peristalsis, and that's the rhythmic relaxing and contraction of the colon and in the GI tract. So what happens is you get the contractions that usually are in a nice rhythmic pattern either slow down or they become uncoordinated, and then what happens is the food and stool in your intestine sort of gets stuck and can't nicely, efficiently move through. It gets stuck there, and then as part of the digestion process, water gets removed from your colon, so the stool that's sitting here gets harder and drier and more difficult to pass. As well, another thing that we hear from people is that it's difficult to contract the abdominal muscles, and also the anal sphincter may not relax at quite the right time, allowing you to pass the stool easily. So there's, again, a few things going on here. So what can you do? Fluid intake is important because you need water to keep the stool easily passing through the colon. You want to increase fiber-rich foods, and that can sometimes be a challenge if someone has difficulty chewing and swallowing. It's harder to have a diet full of plenty of fiber, which keeps the stool soft and easy to pass. And again, you need lots of water with fiber to help things move through your body. Okay? Exercise is really important. It stimulates the bowel and gets it moving. As well, there can be simple things that you could do, like a belly massage. I don't know if anyone's seen this, where you put one hand sort of at the top of your stomach and one above the pubic bone, and you just kind of 2 to 3 times a day just kind of manually massage the abdomen, and that sort of stimulates the peristalsis and could perhaps help to move things along. Another thing is this thing that I've got the picture on here. It's a stool that elevates your legs. It supposedly simulates a more natural position for having a bowel movement. So it might be worth a try if it's really difficult for you to actually pass stool. As well, laxatives, particularly the PEG or the propylethylene glycol, Laxaday, Miralax, those are particularly effective for Parkinson's disease. As well, there are motility medications that can speed up your stomach and your bowel as well. Okay. Sweating. Perspiration or sweat helps regulate our body's temperature. It keeps your body cool when it's in hot weather, during fevers, or when you're exercising. You sweat to release that extra fluid, which brings down your body temperature. Often, people with Parkinson's disease find that sweat production tends to be reduced in the extremities, such as the hand and the feet, but they get more sweating in the body, on the body and the face. Okay. As well, you may be likely to sweat excessively if you are off medication. Some people find as they're wearing off, they become very diaphoretic, or if you are on medications and you are dyskinetic, that might increase the amount of sweating or perspiration that you are experiencing. As well, some people experience what we call night sweats that can be quite uncomfortable and disrupt sleep. So, what to do? Avoid hot, humid, or crowded environments when possible. Wear loose-fitting natural fibers, so cottons and that sort of thing. Avoid triggering foods or like hot, spicy foods or alcohol if these tend to make you sweat. Drink plenty of fluids to replace any of the losses that you might have through perspiring. If nighttime sweats are a problem, cotton bedding, which will help sort of wick the fluid away, and setting the house thermostat lower. As far as hygiene, you may have to increase the amount of showering that you do, but one thing I just wanted to bring up is with Parkinson's disease, you have a decreased sense of smell sometimes as part of your disease, so you may not be aware that there is a body odor there, so just being aware of that is an issue. And again, there are medications that can help with sweating if it is a big problem for you. And they can actually give Botox to the sweat glands as well to decrease production. So there's things that can be done to help with that medically as well. Okay. As if you don't have enough to deal with when it comes to Parkinson's disease, diminished sexual function is practically inevitable. From lack of desire to low libido to difficulties with orgasmic functioning, Parkinson's disease can impair your sexuality in one way or another. In Parkinson's, it's complex. You've got the chemical signals that usually happen automatically with sexual arousal. They're no longer working properly, but then you add in muscle stiffness, rigidity, tremor, fatigue, non-motor symptoms. If you've got urinary urgency, it becomes very challenging. And prevalence of sexual dysfunction in Parkinson's is high, around 70 to 80%. And then when you add in other aspects of normal aging, such as menopause, prostate problems, medications with side effects, disease progression, it's very difficult to become intimate. It is important, though, that you don't just assume this is part of normal aging or part of Parkinson's disease. A lot of people are unaware that their sexual dysfunction may be related to their Parkinson's disease. And there are things that we can do to help treat it. So other things you can do are planning sex when your motor symptoms are at a minimum. Satin sheets for ease of movement if moving is difficult. Regular exercise to increase stamina and decrease fatigue. You can consider other forms of intimacy, hugging, cuddling, just being close. Rule out underlying causes. For example, people that have depression or anxiety, that also contributes to low sexual desire. There are medications that can be used. And I just wanted to point out that Vancouver does have a Center for Sexual Medicine at UBC, part of the Department of Psychiatry. So if there are experts out there in British Columbia that can help you with sexuality and intimacy if this is a concern for you. Okay. I just was wondering if people have seen this form before. It's the non-motor symptom questionnaire for Parkinson's disease. Yeah. I think this is a great form that if you're going into your family doctor or to see your specialist, it's a good idea to fill out this form before you go in, because it highlights a lot of the non-motor symptoms, both autonomic, cognitive, and other symptoms such as pain, so that you have an idea of things that you might want to consider talking to your physician about, or give them the sheet so that they can see what the issues you are having going into the appointment, and they can be addressed. Because sometimes it's really hard to remember everything that's going on with you. You think, I've got to remember to talk to them about this, and that. If you fill out this form, this covers a lot of the non-motor symptoms and can be a great tool to help you address those issues with your physician. I'm going to switch gears a little bit and talk about cognitive changes in Parkinson's disease. Okay? Cognitive changes in Parkinson's disease are common, although not everybody develops them. Cognitive changes can range from mild problems to more severe problems that can affect day-to-day functioning. Cognition, we generally think of it as our thinking or memory. Cognition is actually the action of acquiring knowledge and understanding it through thought, experience, and through our senses. And it includes a variety of mental skills such as attention, memory, language, visual spatial skills, and other aspects of reasoning and general intellect. So there are some cognitive changes that do occur in Parkinson's disease. You can have normal cognition with no changes at all. There's something called mild cognitive impairment, where changes do occur, but they're generally not significant enough to disrupt daily life and the activities of the person. And then there is what we call Parkinson's disease dementia, where there is a greater degree and variety of cognitive deficits that occur that substantially impact day-to-day functioning. Okay? About 20 to 50% of patients, that's a large discrepancy, but different literature says different things, but about 20 to 50% of Parkinson's patients will develop mild cognitive impairment. It's important to know that mild cognitive impairment in Parkinson's disease increases the risk of developing dementia. However, mild cognitive impairment does not always progress to dementia. Okay? Some people just have mild cognitive impairment. Progression to dementia is not inevitable, but it does develop eventually in about 80% of patients who have a long duration of Parkinson's disease. So what contributes to cognitive impairment? There are memory and attention changes in the normal brain as we age, but with Parkinson's disease, some of these symptoms appear earlier. And also, coexisting conditions can affect your cognitive skills as well. For example, if you have depression, it can cause symptoms similar to cognitive impairment, like forgetfulness, memory loss, difficulty concentrating, among other symptoms. And then other diseases, such as diabetes, can cause vascular changes in the brain, which can lead to some memory changes. And also infections. Infections, though, cause a more rapid change in mental state. So, but you still need to rule out everything to be sure that there's not something else going on. Sleep. If somebody doesn't sleep well, it affects your alertness, your judgment, your memory, your coordination. And sustaining attention can be difficult if you're sleep deprived. And people that have hallucinations tend to have more issues with cognitive impairment, and people that have more severe motor fluctuations in Parkinson's disease. And I think this relates more to the fact that the disease is probably more advanced. Okay, so why do people with Parkinson's develop cognitive impairment? The exact cause is not known, but likely due to a combination of chemical and structural changes. In addition to dopamine, Parkinson's affects a large number of brain chemicals that support cognition, mood, and attention, such things as norepinephrine, serotonin, acetylcholine, to name a few. And as well in Parkinson's disease, there's a large buildup of a protein called alpha-synuclein in the brain that clumps together to form what we call Lewy bodies. As more and more of these proteins clump together in the nerve cells, the cells lose the ability to function, transmit messages, and eventually will die. Okay. So what you might see, don't just brush off memory changes as a normal part of aging or inevitable in Parkinson's disease. The focus on cognitive impairment in Parkinson's disease is shifting from looking at dementia to now looking at the earlier stages of cognitive impairment. And this shift is primarily being spearheaded by the desire to improve long-term outcomes by delivering interventions earlier in the clinical course of the disease. So basically, the earlier we treat, the better the quality of life for a longer period of time. So don't just brush it off as that this is going to happen. If you're noticing changes in cognition, you want to talk to your doctor about it early on and see if it can be addressed. Okay, so what is mild cognitive impairment? What might you see? As movement slow in Parkinson's disease, so can your thinking. Slowed thinking affects the time it takes to register and respond to information presented, and is often experienced when we're trying to solve problems. Some people have difficulty retrieving information from the memory, and there can be a delay in responding verbally or physically to someone or something. So in Parkinson's disease, you have slowed thinking, just like your movements slow down, so does your thinking, and your ability to process the information and respond to it becomes slow. So your reaction time to something might be slower, or your ability to verbally respond becomes slower. And because of this, people tend to withdraw a little bit because they can't follow the conversations, or they may not be able to respond quick enough in conversations to feel comfortable. There's also changes in attention. Over time, you may notice problems with planning and completing tasks. I've heard from many people that their loved one may start different projects, and they'll have 3 or 4 different projects on the go, but nothing ever gets completed. And it's not because they don't want to complete it or they're lazy. It's just that they can't complete the sequence of going through planning it and actually completing it. It takes more effort to focus, and there's also difficulty with multitasking. It can be as simple as walking and talking at the same time. You may find that you're slowed walking if you're talking, or trying to hold a cup of coffee and walk to the kitchen table. There can be issues in what we call executive function. Executive functions help guide behavior and help us to make decisions about goals and how to meet them. They allow us to plan, to make plans, finish work on time, cope with distractions, ask people for help, and figure out whether something is a good idea or not to do. Okay? They help us not overreact to small problems and focus more, and allow us to focus on more than one thing at a time. Okay? So what you might see is some difficulty with time management. Then that's a common complaint I hear from families as well. It takes forever, or so-and-so has always loses track of time. They may become focused on doing a small task and get sort of fixated on it and have difficulty pulling away from it. There's difficulty anticipating consequences, so judgment can be impaired. Difficulty making decisions and switching focus. Some people get fixated on a certain idea or task, and it's really difficult for them to switch off of that and start looking at something else. And problem solving may be affected. Okay? With memory changes, you may see decreased memory for recent events. Long-term memory tends to be intact. It's more the things that happen on a day-to-day basis that are more difficult to remember. And there could be some difficulty remembering how to do familiar tasks. Something that someone's done their whole life, they may not now be able to do those tasks. With language, you'll notice that language becomes simpler. You might notice the person using fewer words due to problems finding the right words, and also they may have some difficulty comprehending what is being said. So there's something they call the tip of the tongue phenomenon, where you know exactly what you want to say or get the word, but you can't find the word. It's right there on the tip of your tongue, but they can't get it out. Difficulty speaking under pressure. So if they're being asked, to tell me right now, they may not be able to get out what they want to say. Difficulty understanding complex sentences. So more than one idea in a sentence. And there could be problems with naming or misnaming objects as well. Visual spatial problems. There may be problems processing information about the physical surroundings. You may have trouble navigating in familiar places like your house. You may be unable to correctly guess the height of steps, curbs, where doorways are, and may bump into doorways, that sort of thing. And as well, visual spatial problems contribute to those little illusions that some people have, where they might be seeing things or shadows out of the corner of their eye, especially when it's a low light situation. So in the dusk, people may see more little shadows out of the corner of their eye. So how is cognitive impairment diagnosed? There's no tests that we can do to confirm cognitive impairment. It's more just sort of what families tell us, that they've noticed subtle changes, or maybe more than subtle changes, in how their loved one normally functions. Again, you want to make sure that you rule out other causes for cognitive impairment, such as depression, vascular changes, fatigue. As well, a lot of people with Parkinson's have visual deficits as well. Make sure that it's not related to visual impairment or hearing impairment. Because if you can't see or hear well enough, it's often difficult to learn, remember, or retrieve information. So we do some screening tests that some of you may be familiar with, and you may have had when you've been in the clinic with the neurologist. We do we call them memory tests. And we use them as more of a guide to see from appointment to appointment whether there's been change in the thinking, and just sort of for us to sort of clue in that there may be a change and maybe we need to investigate what is going on. And if there is real concerns, there may be referrals to neuropsychological testing that may help truly identify is this an issue related to mild cognitive impairment from Parkinson's disease, or is this an issue with depression? And if we treat the depression, maybe the cognition will improve. So there's lots that can be done. And this is just a copy of one of the memory tests that we use, and many of you might be familiar with this one. This is called the MoCA, or the Montreal Cognitive Assessment, and this is used widely in Parkinson's disease. It tends to be quite selective for Parkinson's disease and the issues that, the thinking issues that people with Parkinson's have. So there's a lot of things that you can do to manage changes in the memory and thinking, and the overall goal of the strategies are to help people with Parkinson's with their cognitive tasks, communication skills, activities of daily living. Overall, we want to increase the quality of life and address safety concerns. Okay? So I'm not going to go through all these because there are a lot of them, but one thing I wanted to just mention is around activities during the day. I hear from a lot of families that, they always feel that their family member may have a lack of motivation. They don't get up and they don't move and they don't do things during the day. And it's probably not a lack of motivation that we're seeing. It's more that they don't know how to start something, and the tasks that we're giving them may be too overwhelming. So breaking activities into small steps that are more achievable is a good thing. You could ask your family member, what is it that you want to do today? And you can break the task down into small steps, and you can write them down and even a checklist and have them check off during the day that they've done this. But it is important that daily routines that are kept fairly constant, people do better with those. Loud rooms with distractions like a TV or a radio when you need someone's attention, turn off those TVs and radios. Keep rooms well lit. Exercise is very important for mental health. Stimulating the brain with puzzles, playing cards is a really good way to keep mentally fit, and by learning new things. Okay? Being social, it's hard sometimes because people tend to withdraw a little bit with Parkinson's because they can't always follow the conversations, but you want to make sure that, that you still engage with family and friends, and you might want to instruct family and friends to keep conversations simple and ask questions that require short answers, even as simple as yes or no, so that the person can participate without having to think up a long sentence to reply with. Okay? You might want to address things early on, like driving, whether it's safe to leave your loved one alone, using appliances or power tools. Have discussions early on about the person's needs and wishes about the future, such things as finances, power of attorney, future care. And also make sure that as caregivers, for the caregivers out there, that you take care of yourselves as well, because you need to be well in order to help your family member. Just really quickly, there are medications that can help with memory challenges, and your family doctor or your neurologist can help identify if certain medications can help. There are medications that we use that interfere with your memory as well, such as benztropine, trihexyphenidyl, some of the amantadine, some of the medications that we use for Parkinson's. So if that might be one of the things that is first done, is to withdraw some of these medications to see if they are what the cause of the cognitive change is. Be sure to take your Parkinson's medications on time, because when you're off, you often get foggy or cloudy thinking. And sometimes stimulant type drugs like that they use for attention deficit can help with extreme fatigue and make you more alert, and then your thinking is better. Okay? And then there are a few medications that are used to slow the progression of cognitive decline. Okay, I'm just going to slip past that just to the very end. Just it's important to remember, not everyone with Parkinson's disease experiences cognitive changes, and not everyone with cognitive changes experiences every symptom. PD-related memory changes occur gradually, so if you see a sudden increase in confusion, that needs to be investigated, because it's usually related to an infection or some other process going on. And early intervention and treatment increases quality of life. Okay? So don't accept that cognitive changes are inevitable. Investigate the cause and initiate early intervention and treatment to extend a good quality of life. And I think I'll leave it there. Yeah.